Dr. Charles Sefcik with the Life Enhancement Clinic, and I want to talk to you today about motion. The movement of our spine is really critical, not just to prevent degeneration and deterioration of our spine and our joints, and not only to prevent us from having painful syndromes develop, but also that's how our brain is fed through activation of the joints of our spine and the activation of all the muscle spindles throughout our body. Now, muscles move bones, and then nerves actually apply to the muscle to cause the muscle to contract, and so this entire element needs to work right. The nerve must work correctly. The nervous system must be firing appropriately. The muscles must be healthy to take that nervous signal, and obviously the bones and the joints need to be healthy as well. And so one of the greatest indicators if there's a problem in any part of the neuromusculoskeletal system is decreased range of motion or improper range of motion. So you have faulty movement patterns. So today I want to talk about the neck. Neck pain is a huge concern for so many people. So many people suffer with headaches and neck pain, and a simple test that you can do at home can actually turn into a therapy as well, is to look, do you have restricted range of motion in the neck? Now, the neck is designed to move in 6 different ways: flexion, extension, rotation, and side bending or lateral flexion. So again, that's flexion. We just tuck our chin down to our chest. Extension, should look back as far as you can up to the ceiling. Rotation, like you're looking over your shoulder from side to side, and then side bend into lateral flexion. Now, if you get pain in any of those movements, then that's an indication there's something going on with the neuromusculoskeletal system and should be evaluated. If there's restriction of the range of motion, that also should be evaluated. Or, we see this a lot, people will have almost normal range of motion, but if you watch closely and observe them, you'll see that they'll start to go back, and then their head might kick back, or their head might fall forward. And we can call that a cervical extension syndrome or a cervical flexion syndrome, and that's an easy way to look. So find someone to help you, sit down with somebody, and evaluate each other for altered neck range of motion, and just have the patient look to the left as far as they can and make sure they can have a nice, smooth, fluid movement without catches, without pain, and without their head kicking back to the side or extension. And those are easy ways to look at cervical range of motion. If any of those are abnormal, if there's any pain, any muscle tightness, any pain down the arms, anything that would indicate that there should be a further evaluation, feel free to call the office at 323-0266, schedule an appointment. We can evaluate that further, and we can also begin to look at all of the nerves that exit the spinal cord at that level and make sure that you're not having any muscle weakness or any nerve damage or any peripheral nerve symptoms. And so those are further evaluations that we can do. But for you right now, do the range of motion, and guess what? The assessment is actually a great therapy. So every day you can spend time running your cervical spine through appropriate ranges of motion with flexion, extension, rotation, and lateral flexion or side bending, and you can decrease neck pain, improve range of motion, and prevent the deterioration of those joint spaces on a daily basis. So I hope this is helpful for you. If you have any questions, feel free to ask those in the comment section below, or if you wanted to say how much these exercises have helped you with range of motion, go ahead and leave that comment below as well. Thank you for your time and attention. Again, I'm Dr. Charles Sefcik with the Life Enhancement Clinic. Have a great day.